This lecture will do on the short lessons about movement, and I would like it to video so you can learn it at home as well. We'll do it together now. So we'll start with flexion. Okay. So flexion is where you take your body into anatomical into a curl like a fetal position, and so if you look at the neck, flexion would be like moving forward. The whole spine would curl forward. The fingers, wrists, elbows. Yeah. The harder one to imagine is the shoulder joint. And the shoulder joint, you see the humerus and the scapula. This is the shoulder joint. So the movement forward is flexion and backward is extension. However, as we'll see later, shoulder joint, the shoulder can move also forward, backward, upward, and downward. Yeah. So we have to, when we talk about the shoulder, we have to be sure that we refer to the right joint. There is the shoulder joint, which is again the humerus to the scapula. And there is the movement of the scapula itself. Remember we did last time when you're moving your scapula up and down, yeah, forward and backward, yeah. Can you do it now? Yeah, yeah, up and down, forward. So this is called protraction, retraction, doesn't it? And then this is different. This is a movement of the shoulder joint. The one we did before is the movement of the scapula. Okay. Any problem with the flexion? Okay. Extension, opposite, right? Yeah. Good. Now, next one is, we leave hyperextension. That's very important. And then we'll go on to the lateral flexion, side bending. Everybody can side bend? Yeah? Good. Good, side to side. Fantastic, great, tick it. Abduction. Let's do it only with one limb. So abduction, both the hip and the shoulder. Yeah. So abduct means taking away. Adduct with double D, you adding it back. What is this one? It's also adduction. Yeah. So adduction starts from here back to anatomical position, but it can go beyond the anatomical position. Yeah? If you want to dance once. Yeah. Okay. Rotation. Where can we rotate? Spine. Yeah, good. Neck, spine. Yeah. And this is, we're coming to, where else can you rotate?
Your hips.
We have two rotation here. We have the shoulder joint. The best way to look at rotation of the shoulder joint is to put your elbow in a flex position, so nothing happens in the elbow, and then you move it side to side. This is internal rotation, external rotation. And you can do it in the hip as well. Can you lock your knee and lock your ankle joint? Can you now rotate it? Rotate the hip joint. It's a lot smaller, do you feel? Yeah. It's quite, and it's coming from the hip. So you're doing now this movement. The second joint that you can rotate is the elbow. And we have a name for it. And it's not a position, it's a movement. So we have to take it from, say, here. And this movement called supination. It's like serving a soup. And the other one would be a movement, so it is a process called pronation. Yeah? Who would have problem with it? People who need to screw a lot of knots, yeah? So imagine, sometimes if you get to IKEA and you buy something, and then you have to just go and you start feeling these muscles in the forearm of supination and pronation. Circumduction, there is a difference between doing that, which is rotation, and circumduction. Yeah?
What?
circumduction. It's like circling. Yeah, circling. Now we have 4 movements that are very important into the shoulder. I want you to get into pairs. Okay? Get into pairs. And what I would like you to do, one person would can feel the shoulder, the scapula elevation, depression is down, protraction is forward, and retraction is backward. This one as a pose of, what do I do now? Flexion and extension. Abduction. Fantastic. Okay? Do it in pairs, please. And I want you to feel this. Traction. Retract. You go backward, yeah? Retract. Yeah? Elevation. Change, please. Change. Yeah, this movement of the shoulder complex is very important because a lot of people would come with, oh, I have neck pain, and they, what would be the position of the shoulder? How would you call it? Protraction. And whether the shoulder would be also elevated slightly or depressed?
Elevated.
Elevated. So this is the beginning of you understanding what happened into the shoulder joint. And after that, we'll see what happened to the muscles, how the muscles get tighter, and then treatment, really. And this is one area that you will have a lot of focus with lots of clients. You know, everybody's complaining, neck, shoulder, upper back, pain, aches, tension, headache, feeling of tiredness in this area, yeah? Quite important. Where are we now? Good. Page 3, depression. Actually, what I would like to do from those, yeah, good. Okay. Inversion is sole facing each other. Eversion is opposite. Yeah. It's a small movement. Yeah. Good. Supination and pronation is actually pretty much the same thing. So some people would say inversion or supination, but the one I would really like to see is dorsiflexion, and plantar flexion. Imagine that you're planting your foot in. Yeah? Plantar flexion, dorsiflexion. Why I'm saying that? Because usually when you go to the gym, how do they call this movement? They say flex your ankle or foot, and it's actually not flexion, it's extension. Sorry, I'll repeat it again. This is extension or dorsiflexion. It's very confusing, so I would rather you have it in the video. It will take you a few goes to do that.